Just 1 in 5 drugs are currently prescribed to treat the disease they were originally approved for. So called off label uses are legal and an accepted practice, but it's been getting renewed attention since doctors began prescribing the diabetes drug Ozempic for weight loss, leading to widespread shortages and the use of less regulated replicas. I'm joined now by Dr. Joe Sirven, former professor of neurology at Mayo Clinic and neurologist here in Jacksonville. Dr. Joe, thanks for being here.
It's always a pleasure, Ian.
That's our Dr. Joe from our Saturday show. What's health got to do with it? But he's joining us today. I'm also joined by Dr. Natohya Mallory, clinical ambulatory care pharmacist and an assistant professor at the University of Florida College of Pharmacy. Welcome, Dr. Mallory.
Thank you. Good
Thanks
to be
for
here.
being here. Yeah. And to our listeners, have you been prescribed drugs for an off-label use? And how do you feel about the popularity of some pharmaceuticals spreading through social media? Give us a call at 549-2937 or email us at firstcoastconnect@wjct.org. You can also message us on the First Coast Connect Facebook and Instagram pages, or you can tag us on air at X at FCC on air. Dr. Natohya Mallory, explain why some drugs are prescribed for ailments that they haven't been approved to treat.
Well, the reality of it is the drugs that are being produced, they don't know exactly everything that's going on or what they can do. So a lot of the medications, they are FDA approved for one thing. If they notice that there's something else or can treat something else, then they do have to go through a different process to get that approved. So some of the off-label uses are helpful, and then they start the process with the FDA to get that approval for the off-label uses. It's just impossible to know everything that the drug can do without it being out there in the population, because the clinical trials are definitely small, but when it comes in and hits the U.S. population, they can definitely see what all it can do, and then they can go down the road to get that approved. And so it's no longer off-label use; it's actually used for that treatment for that disease state.
But it's almost like pharmacists and doctors are noticing, observing these things happening to their patients and then saying, oh, hey, this might be useful.
Yes, actually, and there's a process for that once they do notice that it is useful, and they actually go to the drug manufacturer, and then they initiate clinical trials to make sure that this is something that is safe and can be used for that disease state or whatever, even some side effects that they didn't know, like the diabetes medication. The side effect is that it causes weight loss. It wasn't the original intent. So once they found that out, that's when they went down the process of, oh, let's see what this does and actually have another study to find out how it does affect with weight loss.
And it does take a long time for drugs to get approved for certain uses. And
Absolutely.
so I guess in the interim, when something is awaiting that approval, this is just sort of a workaround that doctors can use.
Well, actually, they can't do that until after the drug is approved. So after the approval process and the FDA approves it for that specific disease state, like it's approved for diabetes, if they notice that it is causing weight loss, then the medication, the providers do go to the manufacturer and say, hey, let's start up a study. And then the manufacturer does then perform and decide to do the clinical studies to get that further approval for the FDA for weight loss or anything like that, like Ozempic has done.
And so, Dr. Joe, they're awaiting approval for the off-label. I mean, currently Ozempic is approved for diabetes treatment. Is it currently approved by the FDA for weight loss?
It does not have that approval just yet. So what happens is that they have to prove that they have all of the safety, the dosing, the manner that you do that is appropriate and has been shown just like any other drug. What's hard is that when a drug is approved for something else, there is really nothing that stops you from prescribing it for another purpose, as long as you can obtain it. The only thing that's happened more recently is that insurance companies are way more savvy about looking at how you prescribe, and if they see it that it's not for a diagnosis that it's covered, sometimes they just say no, and that practice gets curbed. But for the most part, you can write a medication for almost anything.
And so how does that affect doctors, Dr. Sirven? They're trying to get drugs for their patients, for instance, if they need a diabetes drug, but then they're becoming popular for other uses. Sometimes patients can't get them. Meanwhile, you've got TikTok promoting a diabetes drug for weight loss. How does that impact you as a physician?
As a physician, it is so difficult because it for many years, it was very simple. You wrote on a prescription pad, we wish you the best, call me to tell me how it's going. Now what happens is you write the prescription out, then suddenly the person, you get a phone call about an hour, 2 hours later, we can't get the drug. What else do you recommend? And then you're like, well, I'm not sure this is what I want you to have. And so it really then gets you into second, third choices. And then you're really in this new calculation of like, is this really going to help when it's not the drug that I really want you to take? So in short, it really throws a wrench into the whole system, because you're now kind of guessing if the second or the alternative is going to help you out.
So, Dr. Mallory, you're saying that one of the side effects is weight loss for Ozempic, but there's also some interesting other side effects that have been discovered. So, in some cases, it can reduce people's craving for alcohol. It can reduce their dependence or their need for nicotine and opioids. In some cases, they found it might even be linked to reducing compulsive behaviors like shopping and gambling. And so there's all of these things that potentially it could be used for, but all of that isn't, proven yet. So is it possible for a drug to kind of get out over its skis a little bit and start be used more widely than really is practical?
Yes, and I think that's what kind of runs into it. Unless those side effects are documented with the manufacturer, and the manufacturer actually has that listed, we don't know if it's actually a small amount, what percentage, is it all population? So it's all about tracking and understanding what those side effects are. Is it a couple of people? Is it only a handful of people that say it's helpful with alcohol dependence? We don't know. So those numbers and things like that, if it's not tracked, we don't know exactly what it does and how it does affect the population, as well as how it works. The other thing is a drug like Ozempic. It does already have another medication. It's already approved. A separate drug for Wegovy is approved for weight loss. The doses are different. The active ingredient is the same. But again, when the drug is approved for weight loss and a prescriber writes it for weight loss, it has to be that brand that the FDA approved it for weight loss. And then you come into the cost. How much is it? Is it covered? And is obesity recognized as a disease state that the insurance will cover and say that you can have this drug for weight loss? I think that's what we run into. So even when we see it, that's putting the pharmacist now kind of like the gatekeepers as well, because when the drug Ozempic comes through and we see it and we see the diagnosis code that does come through with the prescription, if we see diabetes, then we're like, okay, yes, process it. But if we see weight loss, then again, the insurance company has a hard stop. It's not supposed to be used for that. We have to call them, hey, did you want to change this to Wegovy? Then once we do, it's not covered. The patient's like, that's not what I want. So I'm not going to pay for that. So it becomes a sticky situation, especially with a medication like this that has a different approval for weight loss, that as a brand name that the manufacturer has branded it for, and how we're going to kind of compound that with so many people with diabetes that can take this medication. It's got to be a pros and cons. How fast can they make it? And then on top of those that are using it off-label, it affects those that can actually get it that need it for diabetes.
We're talking about the use of off-label prescription drugs, and we want to hear from you if you've been taking any, or if you've been prescribed any, or if you're having trouble obtaining them. Give us a call at 549-2937 or send us an email to firstcoastconnect@wjct.org. You can also reach out via social media. Dr. Joe Sirven, cost is a big part of it, as Dr. Mallory says. What kind of hurdles does that present for your patients?
And it presents probably a huge hurdle, because one thing that I've watched just as a practicing is that prescription drugs don't follow normal economics. Normally, as everyone starts using it, prices come down because more people go into the market, and then everything goes down. And I'm not an economist, I can say that. In this situation, the prices just go up whether you use it a lot or whether you don't use it a lot. It's just it's crazy. And so what I've noticed is that as people's copays continue to rise and their portion of what they have to pay for prescription drugs rises, that is what I spend a lot of time discussing. Where it used to be which is the best drug, it's actually now become which is the most affordable best option. And that's not exactly the same as the best choice. So it's become huge because that's all we end up chatting about. And that's something that is somewhat new, even for physicians that are writing these things, to get into that world of like, oh, which is the best cost effective version, which is really what the questions become now.
Dr. Mallory, when there is a drug shortage, very often something called a compounding pharmacy will step in and begin providing drugs that are not that the composition is FDA approved, right? But it's not necessarily the manufacturer's version of the drug. So what is a compounding pharmacy in the first place?
So compounding pharmacies are actually, we were just discussing this before.
Yeah.
They're a little nuanced. They've been around for a long time, and they do help a lot of the pharmacies be able to get things that are not normally accessible. Things like eye drops, maybe some antibiotics that's not usually come in a formulation that's for eye drops. Something's very helpful. I just shared a personal story about being able to get medications for my son's eczema. I needed to go to a compounding pharmacy because those products weren't available for their ages in the creams and things like that. So there's a wider range that compounding pharmacies are able to produce the medications that are needed. They don't necessarily step in when there's a FDA shortage. The shortage list from the FDA does come out, and the manufacturers, they try to incentivize the manufacturers to figure out where the shortage happens and try to get the product back on the market. But the compounding pharmacies, the salt products that they're using is not the FDA approved for that. So they are not stepping in to use that drug to treat, like, say, for Ozempic. They're not using the semaglutide to say, okay, now you can use this drug to treat for diabetes. That's not kind of their role. They're able to step in and use the medication for, it's approved. They can use that compound for weight loss, but the salt product is not exactly the same. So the chemical composition, the active ingredient is good, but the kind of the additive to it, because it comes in like a powdered form, the liquid part of it that makes it kind of bind and makes it be able to get and enter the system safely is different. So that part is not FDA approved, and that's something that they cannot claim to be used for that since it's not FDA approved.
And Dr. Sirven, a drug shortage, I would guess, would open an opportunity for some compounding pharmacies to step in and provide. But there's also a bunch of like online providers of drugs. What role do they play, and how reliable are those drugs, or how concerning?
Online providers, it's in the eyes of the beholder. Some of them, it's like going to be a very open answer. Some of them are going to be fine, and others you just don't know. I mean, the reality is, if just walking in is already a concern for something that's brick and mortar, when you have no idea who's filling it, who's staffing it, how it all works. I don't know how this stuff, what's out there. So I'm a little shy about online providers unless it's well known, well executed, I guess is the way that I would kind of put it. That you can almost trust. If you've never heard of it, or nothing's never come out through there, I would definitely avoid it, because I just don't. Online, who knows? Unless it's a very big brand or something along those lines.
The Washington Post just did a lot of reporting on this, and they said that compounding pharmacies are part of it, but this also much cheaper versions, for instance, of the semaglutide. One company they found was selling it for $90. It's about $1,000 a month for
Right.
most people. So they were selling it much more cheaply. They called it, quote, the highest quality and potency available, but the ad included a caveat saying that it was not for human consumption.
Right. Yeah. And I think just like he was saying, even when medications that you get online, how do you know what's in it? You don't know the chemical compound. You don't even know if you're getting a safe product. Honestly, if it's online, and this has been even, throughout history, when the ability to get it from different countries and things like that, the regulation is not there. You don't know if you are getting that active ingredient. They can say whatever they want to online, but you saw the disclaimer. They're not claiming to treat it. They are not, and that's what the FDA requires. You cannot claim to treat something that we did not approve. and they're not. They've told you it's not for human consumption, and it's your choice as a consumer to order it, get it, and if you try it, hey, they're going to say, we put that disclaimer out there. You chose to give it a shot. So that's something that, especially healthcare providers, we are always cautious about. Like, hey, even when they come into the clinics, they're all like, oh, I saw this on Google. And I say, your insurance doesn't pay for Dr. Google. They pay for our services, because you can find whatever it is. And it's very difficult. Once it comes in your house, in your package, you don't know what's in there. You have no idea. So that's very dangerous.
And these are coming from places that aren't regulated in terms of, contaminants or how they're handled or what the process is, or where they come from. So there really is no, but they're kind of in a legal gray area. And if they say not for human consumption,
they told you the truth. It's just that it's on you, your decision. And I know what the normal mind would be. Well, they wouldn't send me something dangerous. It hasn't been tested. It's really the Wild West when it comes to online materials.
One of these drugs that they found online in this investigation said that the package didn't contain any instructions, but an email from the company linked to other buyers that had ordered sterile water and syringes, indicating that would be the way to administer it to yourself if you. So they're again not saying explicitly this is what you should do because it's not for human consumption, but then they're offering you ways to do it.
Yeah, I mean, and again, they're kind of walking around the law because they know they cannot give you instructions on how to inject something that's not for human consumption. They're just going to put the information out there, and if you choose as a consumer to do that, again, they're just trying to get the onus off themselves. Not the safest way to practice as a consumer. I mean, go in, get the medication. And again, we have this conversation in all the clinical practices. What is the most cost-effective medication that we can get to help you? UF Health is an indigent care hospital, so we are always finding what's on formulary, what's most cost-effective, what can be used, again, to get the same end results, to get the best treatment possible. But that is the way we are now. Cost is a factor, and we have to make sure that we are able to get the patient to obtain it, because it doesn't matter what we prescribe. If they can't get it, then it's worthless. It's not usable.
Dr. Joe, shortages come because of certain popularity in drugs like Ozempic, we know, but drug shortages are also driven sometimes by panic buying. Explain what that is.
Sure. So what happens is the FDA does a nice job of alerting when a shortage is coming, because it's by law, companies have to report when there is an imminent or an issue with a shortage. So they have this whole thing pointing it out. Well, very large health systems that are savvy about this stuff, they get those reports. Anyone can get them. They're on the FDA website. And what they do is they immediately start buying as much they can on the market, especially if it is a very common drug that they know by their own metrics what their system is using across multiple hospitals. So suddenly, all those pills or IVs or whatever, they're suddenly off the market because they were just bought out, because people are looking for that. They're hedging to make sure that they want to take care of their patients that are in their health system, and they're going to get that. So when a lot of big players do that, then everyone else is left without those type of elements. And that's one component. So it's that panic buying, it's the quality shortage from a company's factory, because a lot of the medications that we consume now are not made domestically. They're made internationally. And things go wrong in both places. And so, but panic buying ultimately is that it's just hedging and buying it as much as they can so they can protect themselves.
Dr. Mallory, we've talked in the past about some of the challenges that pharmacists face just in terms of the stress of the job and things like that. How does a drug shortage contribute to the pressures that, a frontline pharmacist is experiencing?
It adds tremendous pressure because they come in And in the pharmacy, our job is to provide the medication. No matter how many, I mean, another element of the drug shortage is the pharmacist, we're ordering. The manufacturer's just not sending it. And the patient comes in, they're already sick, they need the medication, and we have no idea. We don't even know when it's coming in, and all we can say is we don't have this medication. Then we have to add to, okay, well, let's call around and see if anyone has it. That is, can be sometimes a 30-minute process while we're trying to fill and do everything else for the other patients that's there. And what if nobody has it? It's very difficult. It's very stressful. And we literally don't know what to do. We then turn to the providers and say, hey, this is what we do have. Can it be used for that? And they have to, again, make that clinical decision. Do I want that? That's not the drug that I prescribe. Is it the best option? Can it happen? Can it work the way that you were expecting it to work? That's kind of the line we go down, but it is very stressful. It's very hard to go and tell somebody, oh yeah, we don't have it. And they're like, why don't you have it? Or we'll say, we ordered it. It should be here next week. Some of our systems don't even tell us that it's not coming. We put in the order. We wholeheartedly believe it should be here in 2 or 3 days. Then it doesn't come in. The patient comes back and we're like, where's the drug? We really don't have another solution. We don't know what to do.
And Dr. Joe, I would guess when you've already had lengthy conversations with your patients about how do we make sure this drug is affordable for you, and then they go and they can't get that drug, you're kind of forced back into a situation where now they're going to have to get the more expensive option.
Yeah, it gets to be a very dicey situation because either they try for the expensive option, but when they go for those expensive options for some of the medications, especially in my area of treatment and some of the neuroscience and things of that sort, we're talking about pricing that they have to cover on their own that's almost equivalent to a mortgage payment or a car payment per month. So it then turns into, do we do that or do we just not do anything? Which you just feel helpless. So then I turn to patient assistance programs at pharmacies, but you have to, those are always tricky too to get into those because you have to really not have money or salary to be able to qualify for those.
Well, I've been speaking with Dr. Joe Sirven and Dr. Natohya Mallory. Thanks so much for being here today.
Thank you.
It's been a pleasure, Ann.